Hello everybody, my name is PUBHLTH and today we're going to be talking about culture, addiction, and health in Turkey. What is the culture of addiction in Turkey? So due to Turkey being a primarily Muslim country, most people choose to not drink or do drugs because Islam forbids doing so. So Turkey is a country that's heavily influenced by the religion of Islam. Therefore, there's a heavy stigma within society for those who do choose to drink or choose to participate in drugs, and that extends to people who are addicted because at the end of the day, they are still users. There was a study that reported self-stigmatization as a common feeling that people who drink and do drugs experience. For example, in Konya, one of the most religious cities in Turkey, alcohol is viewed as sinful and shameful due to its prohibition within the religion of Islam. Another example is in Istanbul, where drug use is more commonly seen. People view them with fear and caution just because they're unfamiliar with their circumstances, and there's just a really negative light shed on drugs and alcohol and addiction in Turkey. Smoking habits, alcohol consumption, and drug use in Turkey. So in terms of smoking in Turkey, around 31.6% of Turkish adults currently smoke tobacco. 44.1% of women and 19.2% women smoke. 51.8% of youth are exposed to secondhand smoke in enclosed public places, and 46.1% are exposed to secondhand smoke at home. So smoking is prevalent enough to where a decent amount of people are exposed to secondhand smoke. However, it's not as common as a practice compared to as in Europe, for example. When it comes to alcohol, in 2021, 85.1% of people reported consuming no alcohol, meaning the majority of the population abstains from drinking. In 2020, Turkey's alcohol consumption was 1.69 liters per person. In 2020, the average alcohol consumption was 3.46 milliliters per person per day. And in 2015, the prevalence of problematic alcohol use was 15.3%. When it comes to drug use in Turkey, in 2017, there was a reported total of 170,000 drug law offenders. In 2017, there was 925 drug-induced deaths reported, and cannabis was found to be the most illicit substance used in Turkey. What are some risk factors that make someone more susceptible for substance abuse and addiction in Turkey? So self-stigmatization is something that a lot of people do experience in Turkey, and that can definitely make someone more vulnerable to developing addiction because they are using those resources as coping mechanisms due to the shame or guilt that they feel from society. Another really big thing I found in my research was gender. Male are at higher risk at developing substance abuse because it is more acceptable for them to be drinking or doing drugs in public, whereas women are shamed more, so they don't do it as often. Additionally, age was something that I found within my research that was a risk factor for substance abuse in Turkey. This is because a lot of kids tend to want to experiment, they tend to be curious, and that has an ability to develop into substance abuse down the line. So over here I put an example. A teenager who started smoking as a result of peer pressure develops nicotine dependence a few years later. This dependence further develops into addiction and continues for years of his life, causing him to develop heart disease in his mid-30s. So that's very much a realistic situation that curious teen can end up in his 30s. So what are the health impacts of substance abuse and addiction? Why is it so bad? So in Turkey, the reported average daily cigarette use was 16 to 17 cigarettes per day. When you're smoking this much cigarettes and ingesting that much nicotine and tobacco, the smoke damages the airways and the tiny sacs of your lungs, and it contributes to raising your blood pressure and heart rate. As well as the direct users being influenced, the people who are inhaling the secondhand smoke end up developing these irritated airways. And in the end, it contributes to tons of diseases. Some examples are chronic obstructive pulmonary disease, pneumonia, and heart disease. So what are some ways we can prevent this and chip away at this problem? Some solutions can be to provide cessation support programs. These make all the resources to stop with substance abuse, alcohol abuse, addiction more available, more accessible with less barriers. Another way to solve this problem is to start targeted interventions for vulnerable groups. Like we said earlier, we saw that men tend to be more vulnerable and children. We can work at prevention strategies, so this raises awareness in settings like schools and clinics, and these can work at, really showing the long-term health consequences of smoking and alcohol abuse. And then from a government policy standpoint, we can do things like make these substances harder to get by maybe increasing taxes and reducing affordability. Thank you so much for listening to my presentation. I hope you guys learned something new.